Organ donation in the United States should be mandatory. Because the demand for organ donations currently far exceeds the supply, something needs to be done. Currently, the decision is left up to individuals or families to decide whether or not they want to donate organs, which leads to disparity for those who are in dire need of an organ transplant. One of the best ways that we can help others is to implement a mandatory organ donation system in the U.S. to support each other's and another person's well-being. According to the United Network for Organ Sharing, UNOS, over 100,000 people in the United States are currently on the wait list for an organ transplant. Currently, the organ donation supply is not enough. For me, aiming to support the health and well-being of others is very important, and I hope that you are in agreement. Today, I hope to persuade you that a nationwide policy be enacted that requires all U.S. citizens to opt into organ donation. To begin, let's first look at some alarming statistics surrounding the current state of organ donation in the U.S. According to the U.S. Department of Health and Human Services, an average of 17 people die each day waiting for a transplant that will never come. We could significantly reduce this gap and save countless individuals by making organ donation mandatory in the United States. One organ donation can save up to 8 lives and improve the lives of over 75 people. In countries with an opt-out system where organ donation is presumed unless explicitly refused, donation rates are significantly higher. For example, Spain, which has an opt-out system, has the highest organ donations amount in the world. One of the reasons you end up hearing these awful statistics within the United States are because currently the U.S. has an organ donation system that is left up to the individual or individual's family to decide whether to donate organs upon a person's passing. Implementing a mandatory system would eliminate the lack of supply, competing with the high demand. As mentioned, countries with opt-out systems such as Spain have a much higher donation rate as compared to opt-in systems. Despite the critical need for donors, only about 54% of eligible U.S. adults are considered organ donors. We've gone over some of the unfortunate facts about the current state of the United States organ donation status, as well as some of the reasons why our organ donation levels are much lower than that in other countries. Now let's look at what can be done to alleviate this issue. The ethical argument for organ donation is strong. Having a cousin who has been on an organ donation list needing 2 kidney transplants over the last several years has been frightening. Thankfully, 2 of his family members, stepped up and donated their kidneys to him, but it was a long, arduous process, and it's really scary to think that there's many people out there who may not have access or family members willing or able to support them. Mandating organ donation can help save lives and support the well-being of others. Other countries have seen the benefits of making organ donation mandatory unless you explicitly opt out. In the U.S., we are losing lives every single day, which is extremely tragic, especially since they could potentially be saved. A nationwide policy that makes organ donation mandatory is a necessary step to address the urgent need for organs, ensure additional supply, and to uphold our ethical responsibilities to each other and as a nation. By implementing this policy, we can save lives and reduce suffering and create a more compassionate society. Thank you.